Hey everybody, Dr. John here. A common question we get in our office is, what is DDD? Also known as degenerative disc disease, wear and tear arthritis, degeneration, arthritis, osteoarthritis. There's got a bunch of names to it, but basically what happens is your normal disc that looks like this in spinal segment have this nice big thick disc, and that's important for movements. It allows us to function normally, to bend over, just to have a normal existence, so to speak. But things happen, and this disc can start to wear out, they thin out, they dry out, and we have this process called degenerative disc disease. So there's very specific phases, but you always have to, one person always starts here and progresses here. The good thing about the process though, it's quite slow. And that gives us some time to intervene if we want to try to minimize the impact of this, stop it, and just make our life a little bit better with it. So one of the questions we get is, what causes this process? And one of the common causes that most have heard is there is genetics at play there. Now, in some people we feel, the research shows that they might be more prone to it. We don't know why, but there could be a gene that allows that to happen. One of the second most common causes is smoking. So smoking basically does not allow things to move in and out of the disc properly, and that will create this disc that dries out and wears down. So that's a risk factor. One of the most common ones I see in my office specifically though is inactivity. So if you don't move, your disc can't act as, say, a clam or a pump that pulls things into the disc and push things out. That allows the disc to be healthy. So if you sit all day, for example, you commute, you come home and sit in front of Netflix, this is inactivity at its best, which sets the stage for that disc to deteriorate over time. Another common cause, old injuries. Yeah, that car accident 15 years ago, that sports injury 25 years ago, all of those old injuries come back to haunt us. And when there's microscopic tearing or injury to the disc, it doesn't show up in some cases for decades. The most common one I see in my office, there's a bunch of them obviously, but the most common is bad posture. Bad posture on a day-to-day basis. Now, things like in front of our phones, in front of the computer. So these create microtraumas, consistent microtraumas over a period of time, add to the risk factors we just discussed, but this causes this problem to accelerate. So being posture aware is a massive thing to help alleviate or minimize the effects of that. So the question is, if you have this process, is there anything you can do? And there absolutely is. Now, one of the interesting things about degenerative disc disease is that the level of degeneration does not correlate to the level of pain you might experience. Meaning that you can have severe degeneration in a disc, and someone might have mild, but that mild degeneration in that one person may have less pain than you, or more pain than you, sorry. So it's not just a pain issue. We need to address the cause, because what is certain about degenerative disc disease is that it changes the biomechanics, how those segments work. And to keep this simple, that means if those mechanics of the joint can't work in multiple segments, then you can't move as you should. You can't bend down to pick up your children. You can't get out of a chair as easily. You can't swing the golf club like you want to, or play the hockey like you want to. It affects our quality of life, not just in the way it feels, but also in how we move and get around. And that just is a massive frustration for people when it comes to their quality of life. So what can you do to help? You need to move more. This is easy. This is the easiest thing you can do to help yourself. Global movements, things like yoga, making sure you're walking a little bit further each day, all those things cause that pump action in those discs. It keeps them healthy, hydrates them, and can minimize the effects of it as you go forward. Another easy thing to do is stretch. We do not stretch enough, myself included. We are creatures of habit. We continue to do our daily activities that we do day to day to day. If we can interrupt our day with some gentle stretching, easy general stretches, will go a long way in helping us. Posture aware. Are you being posture aware with how you sit or commute? Are you making sure you're not sitting on your couch with a slouch posture? Are you getting up from your computer? Are you lifting with your knees and legs and not your back? Being posture aware throughout the day is a game changer. Ladies, think purses on the same shoulder. Men, think wallets in your back pocket on the same side every day. These are little things you can do to change to make a massive difference. What else can you do? Obviously, you can eat better. You know, if we eat wholesome foods that have that have more anti-inflammatory effects, it can reduce the pain associated with degenerative disc disease. And finally, I have to say it, you got to quit smoking. If you're a smoker, it creates a problem where the capillaries can't bring nutrients and blood and everything else to those discs, so they can't heal. This is a chronic problem, but it can absolutely be helped. Use some of those tips that I gave you, and I can guarantee you'll feel better, you'll function better, and you'll be happier for it. Until next time, take care.